Well, the Us Two group is a group of men who have been organized since the 1980s. Started in Chicago, at the University of Chicago when I was there, and has spread all over the world now. There's, I don't know, 20 or 30,000 groups of men. Jim, do you not remember how many men there are? There's at least more than 30,000, probably closer to 300,000 to 400,000 who come to these meetings.
At least 8 other countries.
Yeah, they're in many different countries, and they have a goal of educating men who are either about to be diagnosed, have been diagnosed, or have been living with prostate cancer. And their goal is to learn how to best direct their own care. Now, obviously, they can't all go to medical school, and they can't all be able to read every piece of information, so they share. And then they bring doctors like myself and Dr. Curtis, who's here today, in, and we tell them about what the latest advances are. So that's what the idea is. And so today we have probably about 30 or so guys, most of whom are diagnosed with prostate cancer, some of whom are curious about prostate cancer. They might have it, their brother had it, their father died of it, and they're wondering about whether they should be tested for it, things like that.
People, patients taking charge of their own medical care and being active in their medical care, how does doctors view that?
Well, I think it's a great thing. I've been supporting it for a long time. The biggest problem is there's always a fine line between what the doctors know and what the patients know. Sometimes there's a big gap, and sometimes it's actually in favor of the patient. Sometimes the patients know more than the doctors do about their own disease. So it's particularly challenging to find a doctor who will help the patient learn, but also remains able to direct the therapy.
And some doctors aren't so vocal as far as what's going on and what they're doing and everything. They just kind of take over the care. How is it when a doctor gives the patient all this information? What does that effect have?
Well, the knowledge is power, but too much knowledge is difficult for the patient to absorb. So what you have to do is it's like a school. The patient comes in and you see the patient and you spend some time each visit educating the patient and saying, like today, we just heard somebody asked, well, what is PSA? Well, PSA is a blood test. It stands for prostate specific antigen. And, oh, how's it made, doctor? Well, it's made by both the prostate cancer cells and the prostate. So that if you have a normal man, his PSA will be a certain number, usually less than 4, sometimes less than 3. We would like it to be less than 2. Well, some of these guys have PSA levels that are 10 or 20, some 300. Well, that's a direct result of the prostate cancer being active in their body.
Why is it so controversial?
Well, because the normal prostate makes PSA. And as you age, the PSA gets up as the prostate grows. It's the one of the few organs in the body that gets bigger as you get older. All the rest organs get smaller, the prostate gets bigger. And as that happens, the PSA blood goes up. We now know that if you're 60 and your PSA is less than 2, you probably have a very low risk of getting prostate cancer. If you're under 45 and have a PSA under 1, you're probably protected for life.
And as far as men and getting help with the prostate cancer tests, or even talking about prostate cancer, there's been some hindrance of men wanting to talk about this openly, to get help with this, and even checkups.
Yes, the men that have been most involved in this have developed a series of public service announcements. So we have a program called Checking Under the Hood. A group from New Jersey has put that together, and together they work with the Harley-Davidson dealers and some of the car dealers, and they show that men should have it checked under the hood, you know, a rectal exam and a blood test. the American Society of Clinical Oncology has a program called On the Line, which is featuring sports figures who have been diagnosed with prostate cancer. And then they talk about the prostate cancer so that they encourage men to come out of the closet, so to speak, and talk about what it is. It's the most common cancer in men.
Yeah.
I mean, if you know, by the time you're 80, the estimate is that 80% of men will have a small area of prostate cancer. Fortunately, there are maybe 200,000 people a year who are diagnosed with prostate cancer, 250. Only 25 to 30,000 die of the disease. But that still is a lot. Think about that. In Nevada alone, and we're a small state, there are well over 1,500 men who die or who have developed advanced prostate cancer every year.
So what is your advice as far as men and checkups? What age should they start checkups? How often should they do checkups? And if they are diagnosed, what should they do?
So first of all, men should know what their fathers died of and what their brothers have. If their father had prostate cancer, they should have a PSA blood test when they're 45 or 50 at the latest. If the PSA is over 2, they should be followed very carefully. If it's under 2, or even if it's under 1, I think the chance of having prostate cancer gets quite small, and perhaps every 5 years, or maybe even never again. But if your PSA is over 4, or even over 3, you probably should have a urologic checkup and a prostate biopsy. And if the prostate biopsy is positive for cancer, then you either decide whether you're going to have surgery, radiation, or hormone treatments, or in some cases, it's so little bit of cancer that you don't have to be treated at all.
You should have a prostate checkup yearly?
Well, the answer is yes, if your PSA is over 2. If your PSA is under 1, you probably don't need it checked very often. If you have a PSA that's 2, 3, or 4, I would recommend a yearly blood test.
How treatable is if it's caught early?
It's highly treatable. Over 200-some thousand men are diagnosed every year, and about 80% of them can be cured. In some people, it may be as high as 95%.
What effect does all this have on a man's libido?
That's a big problem. If you have surgery or radiation, it does not affect the libido, but it does affect the ability to have erections. And in some cases, the erections persist, but they're too soft to have good sexual function. Another big side effect often is a bit of urinary problem. Usually that's not terrible. That can be fixed with pads or just being careful about what you take in fluid-wise. But many men are afraid to give up any sexual function, and that is an issue. Unfortunately, the prostate is right where all the nerves go, and either radiation or surgery both can cause sexual dysfunction.
And does this affect at all younger men?
Very rarely, very rarely. It's a disease that begins really to start showing itself between the ages of 45 to 60. The average person is diagnosed when they're about 70, somewhere between 60 and 70. And it's a disease which is slow. So even if it comes back, people can live 20 or 25 years with the cancer in their body and not have it change their life too much. It will affect their quality of life because they'll have to take pills and have to take hormone shots and maybe have some radiation. But it's a disease which is not immediately life-threatening.
When they have a checkup, should they seek out a specialist or should they go to their regular doctor?
Well, this is always a bit of a debate. Their regular doctors generally are not as familiar with the cancer as specialists. Urologists are the ones who mostly handle this, but there are some doctors like me and like Dr. Curtis who are not surgeons, but who specialize in prostate cancer. And as I like to tell my patients, I have the advantage of not having any skin in the game. I'm not a surgeon and I'm not a radiation doctor, so I can be fairly neutral in how I approach this problem.
And I know that we are talking a little bit about radiation today, and you said chemotherapy is one of the directions that you don't normally like to go.
Right. So think about this. If you're going to live for 20 years or so, chemotherapy is usually used in the last 5 years or so of that time period. Now, recently, we have seen some information come from the French suggesting that early chemotherapy may be very helpful. So we are beginning to move the chemotherapy earlier and earlier, and as a result, the chemotherapy side effects have diminished considerably. If you wait too long for chemotherapy, the side effects are quite high. But remember that almost every woman who is diagnosed with breast cancer, diagnosed, not with it spread, just diagnosed, gets chemotherapy nowadays.
Yeah.
So we've moved the field of breast cancer a long ways down earlier in chemotherapy use. We're expecting the same thing to happen with prostate cancer.
And for more information, how can somebody contact you?
So I am on the web at the Comprehensive Cancer Centers of Nevada.com. I'm also listed in Wikipedia, and there's a way to contact me that way. And otherwise, they can just call my office number, which is 702-952-3400 in Las Vegas.